have you here. Hope you guys are doing okay in this really chilly weather, especially in parts of the United States. I know there's also tons of folks internationally as well too, dialing in at really late or very early time. So welcome to all of you globally as well. Looking forward to having a great discussion with you guys tonight about how to do well on the USMLE Step 1, the path to 250, and really beyond, especially with USMLE Pass-Fail coming up in about a year. So, but before I get going, just a little bit about myself. I'm a clinical professor at the University of Louisville, section chief of allergy immunology in Kentucky. But as you know, I'm also the editor for First Day for the USMLE Step 1, Step 2, Step 3. I'm also the chief education officer for USMLE-Rx and ScholarRx. So obviously I do a lot of stuff in education. We have some wonderful panelists on tonight. They're part of our Rx coaches team. These people are wonderful. They can provide you with a lot of advice and teaching and guidance and tutoring in preparing for USMLE Step 1, Step 2, and other exams, COMLEX as well too. All right, so this is the first word in first aid, which is relax. It's been that way for all 31 editions. We've been very deliberate in our philosophy that in order to prepare well for the USMLE Step 1 and the future Step 2 CK, you really need to think ahead about what you want to do, what you want to accomplish. And so you need to clear your head. You got to, take the long view. And so, so don't get caught up in, all the rush and the chaos of what's going on around you and so forth. And so, so that's why we want you to really slow down and relax and think about how you're going to approach the process. So, in the next 50 minutes or so, we're going to, cover a whole heck of a lot of stuff here with regards to, what's in the exam, what's, defining goals, lots of changes with the USMLE, timelines for studying, approaching each of the subjects, prep resources, some study advice, information about our BRICS, our Rx coach, and we got a couple of special offers, including a raffle as well too for our Rx coach, and also Rx 360, our test prep system with test banks, videos, flashcards, and our new Rx Bricks, which is a great foundational study and preparation resource. All right, great. So the USMLE Step 1, is a one-day exam. And let me see if my pen is working. Yep, there you go. It's 8 hours in total. So as I mentioned, one day. There are 7 one-hour blocks, and each block has 40 questions. You are guaranteed a minimum of 45 minutes of break for bathroom breaks, snacks, lunch, so forth. But you can actually get more. So if you look at the schematic here, these are your 7 blocks here and here. Somewhere in the middle, you're going to get snacks or bathroom breaks, as I said. But then at the very beginning, please note that there is an orientation block here. And this orientation will allow you to adjust your headphones for the handful of multimedia items. But this is the same orientation module that you can download from the USMLE.org website. So honestly, you can actually skip most of this module, and you're given 15 minutes, but you only just spend 30 seconds just to use that to adjust your headset. You'll be fine, and then you'll be able to save close to 15 minutes for your break time. So you should really be able to start close to 60 minutes of break time. All right. All right. So moving on. So with the exam, as we all know, it's all single best answer. There are some multimedia questions, and we'll talk about how to handle that later on. Most of the exam is case-based, so you're going to have a clinical vignette, or you're going to have some sort of problem-solving scenario. And I would say, half to 2/3 of the questions are multi-step, or with regards to the reasoning and the rationale and the approach. So here's a simple example here. 32-year-old Caucasian woman presents with a 5-day history of occasional double vision and bilateral ptosis. And so then so that's your considered your stem, the case. And then here's the lead-in. The lead-in is this last statement here, right? What is the most appropriate diagnostic test, right? And you'll instantly recognize that it's actually not asking for the diagnosis. So of course, to be able to get to this, question, which is the diagnostic test, you do have to have one idea, some idea of what the diagnostic test is, right? Or I'm sorry, what the diagnosis is. And then based on this clinical suspicion, then you can come up with the diagnostic test, right? So in this particular case, again, thinking about this Caucasian woman and what's going on with her, the most likely diagnosis is going to be something like myasthenia gravis. You can often see similar presentations in other conditions like multiple sclerosis, but they tend to be more unilateral as opposed to the bilateral finding that's going on, right? So if you now have this diagnosis of myasthenia gravis in your head, then what is the most most appropriate diagnostic test? Well, these days it's going to be anti-acetylcholinesterase antibody assays. That's really the best test in the United States and for many parts around the world. In the past, you could have used classically something like edrophonium, which is a short-acting acetylcholinesterase inhibitor, often known as the tensilon test. But again, this gives you some sense of how you want to be able to break down a step one question and so forth. And again, RX coaches, that's what they train you to do. They have a 7-step process for doing that. And so, you want to ask Sean or Abraham about that, please feel free. But that's how they help you, really master the step one. So again, let's learn a little bit more about the step one. This is the interface, pretty straightforward. Again, you can see that the stem and the lead-ins up here. You've got a minimum of 4, sometimes 5, 6, or 7 choices. About 15 to 20% of the time, you're going to have some clinical imaging. You've got navigation tools and lab values and notes across the top. More navigation around the left side. You've got your all-important block timer. And then the day timer. At the bottom left. You can lock the exam, to go use the bathroom, but the timer is still running. And then when you are done, if you haven't used all 60 minutes, then you can click here and exit the block. And any time you have left over remains for your day timer, and that gives you essentially more break time. In terms of scoring and passing, the 3-digit passing score is 194. It's been that way for a couple of years. The mean, kind of bumps around 229, 230, and the standard deviation has been stable at 20 points. With regards to the actual passing itself, if you're a U.S. medical student, you're essentially just going to pass the exam. All right. Now, if most of the times within the first try, but almost everybody passes within 3 tries. If you're an international medical graduate, whether you are born outside of the United States or born within the United States, you're going to have a lower pass rate. It's going to be high 70s, low 80s on the first try. But our stats and our data indicates that at least that for IMGs the eventual pass rate is greater than 90%. So again, most of you will pass the exam. But of course, we all know that to be competitive for certain specialties, you may need to score a little higher, and we'll talk a little bit about that. Here again is the percentiles curve. They published the data. We actually graphed out as their actual curve, and you can see that with the 194, that's roughly at the 5th percentile. You can see that the average at 230 would give you again 50% percentile, and then at 250, right, that roughly puts you at 1 standard deviation above the mean. And most of the time, we don't really see any scores higher than the mid 270s. At that point, you're well above 99th percentile. All right, So, with regards to defining your goals, in first aid, we try to keep it simple. We talk about just passing the exam. Be comfortably being above 194, beating the mean, right? So 230, and then acing the exam, right? And again, we all know that, sometimes if for some of us, we're considering a competitive specialty, or if you're an international medical graduate, you need to score, well above the mean to be, to be able to score enough residency interviews in either these very selective specialties, right? As discussed in the Roads to Riches mnemonics, or again, if you're an IMG. So we'll talk a little bit more about those numbers in just a bit. I will just pause here to talk a little about the USMLE updates because of the pass-fail thing. So as we all know, the step 1 is going to be pass-fail starting sometime next year. They are on track to implement it in January, but they keep saying that it could always be later as well too. So you're just going to have to keep an eye on that, and you cannot presume that it's going to be January. It could actually be later. This question comes up all the time, which is what happens if you take the step 1 to your 3-digit score, if you take the step 1 before it goes pass-fail? Well, that number remains around. It's going to be on USMLE transcript even after the pass-fail trigger comes around, right? So once you have a 3-digit number, it sticks on your transcript. The other thing that was just very recently announced is that if you're an osteopathic student and you're taking the Complex 1, that's going to go pass-fail sometime next year around May. So that's hot off the press. The other thing that's hot off the press, and particularly relevant to IMGs, but relevant to everybody, is that the Step 2 CS, the clinical skills exam, has been discontinued. They had paused it, but they then made the decision just to stop the exam, for various reasons. For IMGs, ECFMG is adjusting the pathways so that IMGs can get their ECMG certification, without the Step 2 CS. All right, so you'll hear more from the ECFMG about that. All right. Other thing to know is that late last year, the Step 1 and the Step 2 made some changes to the blueprint. So for the Step 1, which is the majority of folks are here about that, they increased the number of items regarding communication skills. For Step 2 CK, they increased the number of items with regards to systems-based practice, patient safety, ethics, and professionalism. In other words, some of the stuff here in particular, patient safety, legal ethics issues, it moved from Step 1 to Step 2 CK actually. All right. There's been a lot of questions, from students and IMGs about the patient communications questions. We've developed, and currently have roughly, 40 to 50 online. There's going to be a bunch more coming, all available now in our rapidly evolving Step 1 QMAX, which itself is under, a major revision. So we're working hard to make sure that we keep you on top of all the Step 1 changes. All right. The other thing is pharmacology. Late last year, what they decided to do is to reduce pharmacotherapy. So what's the best drug for this, or what drug would you use for that? They'll continue to test you on things like drug mechanisms and side effects perhaps, but you will not need to know the specific drug. Like, hey, say Montelukast, for sorry here, did I hide my poll? Okay, I think I did hide my poll. Yeah, Montelukast for for asthma, for example. All right. So that's a big change. Now in first aid, we still have pharmacotherapeutics, but that's because there's a lot of other exams like NBME, shelf exams and stuff like that, and the CBSE exams that still have a lot of pharmacotherapeutics. But remember, on the Step 1, you're not supposed to be seeing much, if any. All right. Getting back to some of the the data with regards to Step 1 and matching and so forth. early on I told you that certain competitive specialties require a bit of a higher score, and you can see them here, right? These are really the competitive specialties, and this data is about a year or two old, but as you can see, the median, at least for U.S. students, is well above 240 in many of these cases, and even close to 250. For U.S. and allopathic students and osteopathic students, there is a silver lining, which is as long as you're interested in a major specialty like internal medicine, pediatrics, which is what my wife did. I did internal medicine and later on allergy immunology. Even if you do poorly on the USMLE Step 1, and by the way, this is really, really old data, but just so don't look at the data, just look at the shapes of the curve. The probability, of matching into one of the big specialties is still pretty high. If you are a U.S. student and you're interested in one of those very competitive specialties like otolaryngology, you do unfortunately have a steep dose response curve. My brother did otolaryngology. If you're an IMG, regardless of the specialty, but particularly the regardless of, but this is really about the the pediatrics, internal medicine, family medicine. There is a flatter curve here, to keep in mind. Again, the data has changed, but we believe that the curves, the shape of the curves, still generally apply. All right, so I threw a lot of data at you guys. Apologize, but hopefully it's useful. And again, we've got this presentation on our blog at firstaidteam.com. I'll show you where to get it later if you want to review any of this. And we also have a video as well too. So I'm gonna go back and ask another question. Now that we've gone through all this, which is, what is your USMLE Step 1 goal? Do you want to pass comfortably? You want to beat the average, or you want to ace the exam? Just keep in mind there is no right or wrong answer. You have to do you, right? But in certain circumstances, particularly if you're interested in competitive specialty, or if you're an IMG, you need to consider, scoring perhaps a little higher, or aiming to score a little higher, to make sure that you are competitive, in the NRMP match. So looks like we've got about 2/3 of you who have voted. Looks like everybody has voted, or close to everybody. It's still tabulating, but I'm going to go ahead and close the poll, share the responses, and clearly, the majority of you folks want to do very well. So ace the exam, 250 or higher. A good chunk is fine with beating the average, and a couple of you folks are happy to pass comfortably. Again, all of these are valid, good answers, but I think it's worth sharing so you can kind of see how you might fit with the rest of your colleagues. Okay. Oh, and I stand corrected. One of my colleagues said we now have over 60 communications questions on Step 1 QMAX. So there you go. Go communicate away in QMAX. All right. Let me get back to the presentation here. All right. So in first aid, we try to keep things simple again with regards to preparation. So we do have a just pass schedule. Which is 1 to 2 months if you have dedicated time. And you can see here, we recommend first aid, crammable subjects, and at least 2 Q banks. I'll discuss why a little later. If you need to score higher, or if you have a history of struggles, unfortunately, with standardized exams like the USMLE Step 1, then you may need to spend more time in. Unfortunately, the sky's the limit. People spend all kinds of time preparing for the exam. So there's no right answer. In addition to all of the above that we just talked about, you're going to obviously cover the rest of the waterfront, and you're probably going to be looking at a minimum 2 question banks, but possibly even 3 question banks. And again, we'll talk about the data behind that recommendation in just a little bit. With regards to choosing study strategies, again, fortunately, all of you have taken standardized exams before, so you have to certainly respect your habits and so forth. especially if they've served you well. But keep in mind that how you do certain things is also tied to the subject, the structure and characteristics of that subject, and also your curriculum, how you were taught those subjects or disciplines or organ systems, wherever you came from, right? And so you need to understand the strengths and weaknesses of your curriculum. Also, with certain subjects like pharmacology and microbiology, drugs and tables. I'm sorry, tables and flashcards happen to work very well because of the structure of the cognitive structure of those concepts. Whereas things like physiology, because it's quite relational and so forth, it may be better if you try to diagram those things out. And then finally, the time that you have for a particular subject, is also important. Like, so again, if you're doing, pathology, you have weeks, maybe months, and so you've got more latitude to use different strategies. If you're doing something more limited, like neuroanatomy, you're going to be basically reading first aid, maybe another review resource, and then doing a lot of Q-bank questions that are tied to that and integrated with other subjects. All right, I'm going to spend the next 10 minutes or so going through a number of, basically some advice on how to approach, all the various disciplines / organ systems. And I'm just going to hit the highlights. Again, all this content, all these slides are available on my blog, firstaidteam.com. I'll show you how to get to that, at the end of this talk. But when you go, as I go through this, just keep in mind there's a couple of recurring themes, and I'll keep homing in on this. The first of the themes is that, even though this is quote unquote a basic science exam, everything they try to do, has generally some clinical relevance, or some applicability. They're not trying to test you on esoteric things just for the sake of scoring, nailing you on a hard topic. If it's difficult, it's going to be difficult because of, perhaps the mechanism, or or perhaps the clinical application. But it is going to be applicable. So so high yield anatomy would still have, would also mean some stuff that has some clinical relevance, like traumatic injuries and so forth, right? So what happens if you have a spiral fracture of the humerus? What nerve gets damaged in the humeral groove? And then what kind of sensory motor deficits does that cause in your hand, right? And then, the other thing that keep, again, with clinical relevance is that they're not going to be showing you cadavers and stuff like that. Structural anatomy, will typically show up on things like X-rays, CT, MRIs, and then the same thing with the histology, the histopathology, with regards to micrographs and so forth. All right, biochemistry is one of those crammable subjects, and again, it's crammable, in the sense that while we all want to learn for understanding, at some point, especially very close to the exam, you're mostly you may have to memorize a little bit just to get that into your short-term memory, and then be able to keep that for the exam. But recognizing that it's not quite yet committed to long-term memory, so you have a chance of losing that afterwards. And so that might be helpful for metabolic pathways and so forth. But again, if you can invest the time in it, again, anything that has clinical relevance, so vitamin deficiencies, genetic disorders that often, have a defect in a various pathway with either, regulatory enzymes or a substrate, i.e. the pathobiochemistry will can be quite testable. All right, microbiology is also crammable, but again, realize that it's not all, bacteriology, right? We kind of tend to equate micro with bacteriology. There's all this other stuff, right? And the key thing with micro is that the information is cognitively organized in a fairly regular way, right? For all the bugs, they're going to be, asking you about, how do you identify them in the lab, on stains and so forth. Where do they go? How do they get there? How do you make the diagnosis again? How do you treat it? What are the vectors? What are the reservoirs and so forth? On the immunology side, and especially in this day and age with, COVID-19, vaccine response is really critical, and the immune response is often tested, in context with, how the immune system is manipulated by the vaccines, and also, how it breaks down with, immunodeficiency diseases that tend to be much more frequent on the USMLE than what you actually see in real life. Trust me, I'm an allergist immunologist. You have to almost be in an academic medical center to see a lot of this stuff. Pathology, again, really big topic, really important. Have had a nice chit chat with Hussein Sattar Pathoma, great guy, and we talked about how things have to evolve, especially for Step 2CK. But in any case, this is a topic where a lot of the hallmark characteristics conditions tend to be typical for rare conditions, but can be more varied for common conditions like, diabetes can present in multiple different ways. Asthma, particularly in children, can present in multiple different ways, not typical and not always with shortness of breath and wheezing and all that type of stuff. It can just be as innocuous as a cough, or having shortness of breath with cold weather or something like that. There can be clues in the age, gender, ethnicity, but don't let that throw you off. In the sense that that could, while they try not to, it could, in some ways be misleading. Just keep in mind that yes, white men can get sarcoidosis, and it's not just a disease of young, black women, for example, right? So so just keep that in mind. Trigger words and buzzwords and stuff like that. Yeah, we talk about them. We use that we talk about them in first aid, but it's mostly in the context of a good memory aid, right? It makes it memorable. But on the USMLE Step 1 and Step 2CK, they're going to clinically describe these findings and so forth. So you need to understand the language. And again, if you do enough QMAX questions in USMLE-Rx, you'll get that rhythm, right? I mentioned earlier that about 15 to 20% of the images questions will have images and multimedia in some cases. It turns out that a lot of times you can answer these questions directly from the STEM, and sometimes you don't even have to look at the image. Now, I know you will. The other thing to say is, don't look at the image until you've had a chance to go through the 7-step process that Sean and Abraham, I'm sure they're talking to you folks about in the chat, but again, use it to. I would mostly use to confirm your diagnosis or your correct answer. All right. I saw some questions about whether COVID-19 questions will show up in Step 1. Unlikely. It's moving really fast. I mean, they may. It's possible they may have something about that's non-controvertible, like the spike protein and so forth. But because it literally takes a year sometimes for them to vet and develop these questions, it's highly unlikely. While we do cover it in first aid, and you do need to know about this, because this is such an important part of medicine now. There's going to be a lag on the Step 1, but who knows? By the summer, we may see more of it. It depends on, again, how quickly they can get it through all their various testing. It has to go through some psychometric testing as well too. So not sure, but less likely now. Maybe this summer, a lot more likely in the fall. Pharmacology, like biochemistry, microbiology is crammable. Again, because the concepts tend to be fairly organized. When I mean organized, they tend to go after things like mechanisms and toxicity. Remember again, no, you should not be tested on pharmacotherapeutics on the treatment. That's going to be moved mostly to step 2CK. At a minimum, you gotta, learn the core drugs and the major variants. The minor derivatives, not so much unless you want to do really well. And in no cases do you ever need to, know the dosages or the trade names unless it's helpful as a mnemonic or whatever. And again, because it's often on the therapeutic side, even though the treatment, you may see it with other, highly integrated with other concepts like biochemistry, physiology, and microbiology. All right, physiology, as I mentioned, tends to be concept oriented, so that's why mapping out diagrams, and that's why any physio you see in first aid, lots of diagrams. We go diagram happy with anything that's pathophys, to help you learn all those relationships between the various hormones and the glands and everything and so forth. And again, especially here, you're going to see almost all the physio in case-based clinical vignette situations. Psychiatry, traditionally can be a kind of ill-defined set of disciplines that are interrelated, including psychology, sociology, and psychopharmacology. We tend to really focus on things like mood disorders, major depression, and so forth, but there's so much more, and that's obviously covered in first aid. So keep an eye on that. And so, again, check out our book. Public health, as I mentioned, it's kind of quickly evolving. Patient communication, so doctor-patient interaction is getting a big boost. You still see a lot of biostats and epidemiology, and you're still going to see, some law, but you're going to see, but a lot of the stuff like ethics, healthcare delivery, patient safety, a lot of that is, we think, is starting to move to step 2, right? So you're going to so keep an eye out for that. They're in the middle of shifting some of that stuff, so we'll see how that settles out in the next couple of months here. And then yeah, so that's it. That was a quick whirlwind tour, and we will, again, all the details are on, are in the slides in our blog, firstaidteam.com, and I'll show you there. Just a couple words about review resources, right? There's a ton of resources out there, QBanks, video resources, multimedia resources, apps, web apps, and so forth. So, what are you going to do with all this, right? That's a lot of stuff, right? And, the issue is that you don't have a lot of money. We all know that, but you also don't have a lot of time, right? So, how do you manage to your budget, and also how do you manage to your time budget? So there's a couple of things to keep in mind. We do have in first aid a high yield review resource, compendium. So you can think about it as the Consumer Reports or the Amazon reviews for all these high yield resources. And we actually provide a comprehensive survey on our blog, firstaidteam.com, as a community, as a global community service to all you folks. So the high yield ratings are published in first aid, but the detailed ratings are on our blog. Whatever resource you use, whether it's a book, app, QBank, or whatever, you want to start using that early, so that you get used to it. You integrate it as part of your studies, part of your coursework if you're still in school. And the other thing is, try not to overbuy. Almost most of the stuff is available through Amazon or digitally these days. Most of the resources are digital anyway, but if it's a book, Amazon can usually get it for you. And the other thing is that some resources are good in some areas and not good in others, right? So just beware, that not everything is necessarily good across the board. All right, so at the end of the day, I mentioned earlier, you want to kind of get started early, and and you want to be very deliberate, right? So as I mentioned, stay relaxed and grounded as you prepare. I'm going to go a little out of sequence here, but I do want to mention that we do have a checklist at the beginning of the book. It's after the acknowledgments in first aid, but before section 1, that can kind of help you organize your preparation. But as you get into it, these are some of the things that we think about. You want to establish a study schedule. We do have a study planner that we just updated. I'm going to have Jeff drop that into the chat box here. And it's free. It's again, it's one of our community contributions. So use that in terms of preparing for your and organizing your exam. The other thing, and you heard about it earlier, remember, particularly for the multi-step questions, you want to be able to integrate, everything, right? So you want to think about how the pathology ties in with the, with the pharmacology or with the physiology and so forth. So be able to integrate and apply. And so, we take great care in trying to explain our multi-step questions in QMAX, and later this summer you're going to see that we're going to do even more to delineate, those various steps. We talked about those crammable subjects: biochemistry, micro, and pharmacology. Again, nobody wants to cram, but towards the very end, if you need to, beyond rapid review, go back and cram some stuff. Those are the types of things that could show up and give you some extra points, and are, sometimes really difficult to keep in long-term memory. All of you are in medical school or have gone to medical school, so you've learned a lot of the stuff before. And so if, as long as it's high yield, prepare that, and focus on what's been previously learned, and that will be the easier approach. And then, as I mentioned, if you stay relaxed and you stay grounded, you should be able to build in time in your schedule to be a human being, to be with friends, to be with loved ones, to take a walk in the park, to exercise, to treat the whole body and not just the mind. We recognize that this is a major and stressful exam, but it shouldn't take over your life. So make sure that you keep some time for yourself, especially during a pandemic when life is already stressful. I'm going to pause there actually for a bit. I want to hear from Sean and Abraham, and to hear more about what you guys as RX coaches often discuss with the people that you're advising and tutoring and so forth. Any additional thoughts?
Yeah, absolutely. It kind of goes in sync with some of the questions we're seeing here, which is students asking us, when should they start studying and when should they start purchasing resources? And we always tell students, the earlier the better. The earlier you start, the better off you're going to be. Students often ask us, how long will it take us to get ready? Well, that's really different for every single student, because every student is so different. We all learn differently, think differently, apply our knowledge differently. So that really is an individual question that your coach can help you with once you start working with them. But it's hard for us to tell you that just right off the top. Another thing, we always tell our students is, don't be afraid to take an assessment. A lot of students are, shy away from that. Remember, it's an assessment. It's a tool. It's there to help you plan, know where to focus, and hopefully make your studying more efficient and pointed. So that's what I would like to share.
Great. Anything from you, Abraham?
Yeah, I'm just gonna kind of echo some of the same things. You guys, some of you guys were asking about, the 7-step process. We do go over that during our Q labs that are done on Tuesdays. So if you guys are interested in that, I would join that as well. Also, if you book a consultation, we'll be able to kind of discuss some of that with you. And once you do join the coach program, we kind of show you how to apply that to every question and kind of dissect the USMLE questions and make it so you are ruling the question is not ruling you. In terms of applying for residency and all those questions there, we kind of discuss that from a case-to-case perspective about how to make yourself stand out more, how to score as high as possible on the exam, and kind of just take it from there.
Great. Thanks, guys. Really appreciate it. All right, so let's get back here. So let's talk about a couple other things related to exams. So CBT stands for computer-based testing, and so as I mentioned, there's a tutorial that's 15 minutes that comes with the sample questions when you go to USMLE.org. So again, be familiar with that. It'll save you close to 15 minutes, gives you extra break time. there's some keyboard shortcuts to keep in mind. And then really, you'll as you hear from the coaches, they're going to want you to do a lot of questions. So you want to do it throughout your studies, and all the way through, and especially towards the end. And there's a lot of scientific data behind this, actually. So there was a major article published in the journal Science several years ago that talked about how you can learn through self-testing, right? And so they randomized college students to various study methods, and what they found out is that self-testing, which is retrieval practice, so that's doing things like QMAX questions or whatever, is clearly superior to other forms of study, even if the questions are difficult or indirect, right? And it's more effective than just reading it once or cramming it multiple times, or even concept mapping or diagramming, right? So this is the key takeaway. So what type of computer-based testing options are there? Of course, so the good news is there's some free stuff, right? There's the USMLE sample test with 100+ sample items. They just recently updated it, so you go through it, you can see that they've taken out almost all the pharmacotherapeutics, all the ethics and all the legal stuff. They have these new patient communication items, just a handful. Not enough to master, but that's what QMAX is for, right? NBME CBSSA, this stands for the Comprehensive Basic Science Self-Assessment. $50 to $60 for an exam. For a forum where they give you 200 questions, you got about a month or two to take it, and then it's good for benchmarking, and so forth. It's a little pricey, so that's where something like QMAX comes in, because we have 2 self-assessments. So our question banks and other question banks are good for practice, self-study, and simulation. One of the other nice features of QMAX, in addition to those 2 self-assessments that can save you some money with regards to CBSSA, is that you could also manually set aside questions for full day simulations as well too, especially if you're trying to understand your strengths and weaknesses and your energy level during the day. All right, now we're going to spend a minute or two on additional research behind memory and learning and doing well on exams. So there's a couple of key things that are out there. One is that question banks are more effective than flashcards. They're both effective, especially with spaced repetition. But QBanks, are more effective because, of course, it's closer to the real thing, on an item per item basis. How many questions do you have to do to score higher on the step 1? That question has been answered as well too, and the answer is roughly between 300 and 450, QBank questions to get an additional point on the step 1. Typically, controlling for MCAT and GPA, particularly, so most of the data comes from U.S. students. Another question is, how many questions should you do? The data says, at least 3,000 questions. In our experience, we would suggest, as many as you can do, 4,000, 5,000, as long as you are doing it in a deliberate way to, focus your learning, follow up on questions you missed, and even the ones that you got right but you were unsure of, spend some time, dissecting and understanding, where the uncertainty was. Another question is whether you should be doing multiple, a question bank multiple times. The answer is no. In the Michigan study, out of the University of Michigan study published a couple of years ago in Academic Medicine, all of the benefit was derived from the unique questions. So in this particular situation, it was 3,200 unique questions. Repeating the multiple choice questions wasn't as helpful. Now, if you want to repeat something because you want to relearn something, fine, but it actually doesn't appear to give you any additional benefit on the actual exam. And then lastly, first data actually works. And again, in the study out of the University of Michigan, students who did 3 or more passes of first aid significantly outperformed students who did not. And one way you can do that is in USMLE-Rx we have our digital first aid flashbacks. that can help you learn first aid. And then when you when you look at the answer, you can then go back and remediate from first aid digitally, in USMLE-Rx 360. All right, let's talk a little bit about test day itself. We're here towards the top of the hour here. So a lot of this stuff I think is self-evident, but it is worth reminding you. You can get a little stimulated, obviously, on test day. You're going to be pretty jacked up. So think about your caffeine intake. You're going to be in an office space. Now, I know, depending on where you're at, depending on the pandemic situation, you need to check on your prometric situation. Obviously, early on in the pandemic, a lot of people had their exams canceled again, and it was a major pain in the butt. Things are a little bit better these days, but you got to keep an eye out for that. Layered clothing, because you're in an office environment, and a lot of times it's going to be cold, but rarely can be warm as well too. So dress comfortably, and so you can adjust. Again, when you talk to our RX coaches, we have this particular 7-step method that we like. There are other valid methods as well too, but in our particular one, even for short questions, we advise, looking at the lead-in as one of the early steps. Okay, so again, you'll see more about that if you talk to our RX coaches, and it's because this gives you some orientation of what you're going to be looking for. With regards to time management, you have 40 questions per block, right? So that translates into, with the 60 minutes, translates into rough, 90 seconds per question, right? We, advise that, you try to commit to an answer within 70 to 75 seconds, so a little over a minute. So that way, you can finish the block. You mark questions that you think are solvable along the way. Try to mark not too many, no more than 8, maybe 10 at the max. So you can go back and try to problem solve those if you think they are solvable. We talked about break strategies and so forth. Some people do 2 blocks, then then break 2 blocks, take a break. Others will go through 3 blocks and so forth, and then take a break. It's all up to you. So again, one of the things that you can do is you can create a full day simulation out of QMAX questions, with 280 questions, and then use that to see where your energy level, and then use that to map out your breaks. The last thing we joke about is something called the C reflex. And the context is that on the exam, there are going to be some really impossible questions. There's some easy questions and there's going to be some really hard questions. That's the way things are go. But also turns out that there are several experimental questions as well too. So so if you don't know the answer, if you can't really narrow it down, pick your favorite letter. Like for us, we joked about C, right? And use that, unless you ruled out C, and hope that it's an experimental question and that doesn't get scored. All right, so that's been hopefully a good review through our through the step 1, and gives you some information about how you might want to approach it, especially if you're looking to score really well, like 250. And so now I'm going to talk a little bit about some of the resources we have that can help you get you there. Some of them, and some of them are actually free. So, so the first one I'll talk about is RX Coach. Again, you've already been talking to our RX coaches, this evening. There is a free consultation. You go. So you go to rxcoach.com. rx-coach.com. I'm sure Jeff's dropping the link if you want to click on it, and you can go there for a free consultation. You can learn more about what we do, how we do it, right? So RX Coach comes with a 160 question assessment that's separate from the self-assessment. We give you a personalized study plan. It's obviously a highly customized one-on-one approach. All of our tutors have gone through a rigorous training process. And they're monitored for quality assurance. We essentially guarantee a good experience, and students have great outcomes. usually you can get 30, 40, sometimes as high as 80 points improvement on the USMLE Step 1. And on top of that, they have access to RX 360 platform with the question banks, videos, flashcards, and the bricks, which again are these wonderful learning resources that walks you through some of the core issues and frameworks of a particular topic. So again, check us out at rxcoach.com. All right, and we can also help you with any other questions as well too. So reach out on social media. If not through RX Coach, then check us out on Facebook, Twitter, our blog, firstaidteam.com. For that, and again, I'll go to firstaidteam.com in just a little bit at the very end, just to show you where you can get access to our presentation. But we're also on Twitter, Instagram, and YouTube. Now I'm going to share with you 3 free no-cost resources that are designed to help you learn better, do better, and have less stress on the day exam or any type of exam. So here's these 3 free resources. Number 1, we have a brand new microbiology course. We also have free biochemistry as well, 2 bricks, and you can access it here. This is a long URL, so Jeff's going to drop the link in here, but it's USMLE-Rx.com general-microbiology-course. We probably come up with a shorter URL next time, like micro course or something like that. But in any case, you can get access to nearly 50 bricks that will take you through a full course, and that's no cost. Just go to that page and click on the green button to create your free account, and you can have access to that. No charge, indefinitely. And also the same for biochemistry. I've talked about this in the past. We have a brand new podcast, and basically it's the audio version of our bricks. They're fun to listen to. You can do them on the go when you're taking a walk or taking a jog or in the treadmill or you're on the bus or on the train. So check them out at usmle-rx.com/podcast. And there's 2 or 3 being released every week. And then finally, our 2021 study planner just got updated, so check it out. And again, we already mentioned that early on. So again, a free resource for you. So those are the 3 free resources I wanted to highlight. We've got plenty of other things as well too. And you have any questions, just reach out to us.